Welcome back to CBS This Morning. Firefighters in Northern California say they're starting to gain control over historic, deadly wildfires that have burned more than 1 million acres.
They get control very soon. One fire casualty, a bird sanctuary that releases endangered California condors into the wild. Now, this danger is likely to continue for days, as Carter Evans reports. The smoke from so-called megafires, is what they call it, is exposing firefighters to more long-term damage than ever before.
Fast-moving wildfires in Northern California have now destroyed more than 1,400 homes and buildings. Beating back flames in these unpredictable conditions is already a dangerous job for frontline crews, but researchers now say it could also have lasting effects on their health.
When you see a community burning in a wildfire, what goes through your mind now?
The level of exposures that these firefighters are getting at these situations, extremely toxic for long periods of time.
Retired Captain Tony Stefani worked for the San Francisco Fire Department for 28 years before he was diagnosed with kidney cancer. He started the San Francisco Firefighters Cancer Prevention Foundation, which funds research to study the link between firefighters' exposure to toxins and cancer.
We can't wait for that latency period for 5 to 10, 20 years down the line to see if these men and women are going to contract various forms of this, insidious disease. Something has to be done about it now.
Captain Matt Alba, who's been with the San Francisco Fire Department for 18 years, spent a week and a half at the campfire in Paradise, California in 2018. The state's deadliest and most destructive fire killed 85 people and destroyed more than 18,000 homes and buildings.
The problem is this is a new realm for firefighting. It doesn't necessarily cleanly meet structural firefighting, and it doesn't cleanly meet wildland firefighting.
He urged Stefani's organization to fund a study analyzing blood and urine samples collected from dozens of firefighters minutes after they left the front lines.
We were starting to see a lot of members with those coughs, headaches. I couldn't help but think about 9/11 and what all of those responders went through 10 years after the incident.
Early results of that study, released this week, show firefighters had a mixture of chemical toxicants and some heavy metals at levels higher than those found in the general U.S. population. In some firefighters, the level of PFAS chemicals were 2 to 5 times higher than levels in the general population. These are chemicals used to make hundreds of household products water and stain resistant that are also linked to kidney and liver cancers. Researchers say the study is a red flag for firefighters and those who live near massive wildfires. Environmental health scientist Mike Wilson says part of the problem at wildfires is the lack of breathing protection. Urban firefighters use air tanks and face masks to safely breathe in a structure fire, but that's not feasible for wildland firefighters who often have to hike for miles and work 12 to 24-hour shifts. Wilson says some in the industry are now working to develop portable respirators that could eventually be used in the field.
It's incumbent upon us, I would say, as a society, to ensure that they have all the tools they need to do their work effectively and safely.
For CBS This Morning, Carter Evans, San Francisco.
Such an important story there by Carter, as we remember that we learned that the chemicals in the smoke could be as dangerous as the flames that those firefighters are fighting, and that those cancer deaths for firefighters should be considered line of duty deaths, according to a lot of the research that's emerging right now. Very important story. We're going to stay with that one. Carter, thank you very much.